Well, what could possibly be working more against my customer than my entire job being to fill up my hospital? See, we build hospitals at the bottom of the cliff. So when people fall off, we can put them back together, making lots of money doing that. We're not incented in any way, shape, or form to put a fence at the top of the cliff. In fact, if someone were to put a fence at the top of the cliff, it would be my job to take it down. Because the only way I get to make money is when my hospital fills up. And that just didn't feel right.
Hey, Po.
Good morning.
Morning. How you doing?
How's it going, Rak?
I'm good.
Good.
Yeah, I have to tell you a story about how today's guest came to contact me. A couple months ago, I posted a clip on LinkedIn of why is there so much burnout in healthcare? And in that clip, it also talked about like the aspirational healthcare system. Because you in that episode had described the transactional nature of healthcare in your experience and just how it sort of can feel that way. And I'd say the inverse of that was what I was describing, which is like a system based on relationships, where you have these relationships with your doctor and your physical therapist and your health coach and your dietitian, all these people who are working together to make you the best version of you. Like the current healthcare system, I would say health means absence of disease. Health equals absence of disease, but it doesn't go beyond that. Actually, good health means so many other things to people. It allows them to live the life they want to live. And so it goes into well-being. So our guest today saw that clip and it resonated with him completely because he started a conference a couple years ago called Aspirational Health Care, which is all about a healthcare system that's centered around relationships. So that's the universe saying, I got to meet this person. So I'll tell you a little bit about him. His name is Darrell Moon. And Darrell, for years, like I think in the mid 80s to mid 90s, was a hospital administrator, like a high-level hospital administrator. And then after about more than a decade of doing that, he sort of got disillusioned with healthcare and how healthcare is funded and the incentives. And he started his own company called Orriant, which is, I guess the simplest way to say is a health coaching company. This was remarkable to me because he started this in a time when I don't think other people were sort of thinking like this or doing this. I'm really interested to hear more about it. More recently, he's been focusing on this Aspirational Health Care Conference. And what's really cool is that Darrell was so drawn to our little clip on LinkedIn. He visited our website. He left a comment. You got a question, and this is for all our listeners too. If you have a question or a comment for us, you can go to thehealthfeast.com and leave a question or comment for us. Well, Darrell did that. And he basically, in a couple lines, told me, this is my life's purpose and mission. And I saw your clip and I feel like we should connect. And so he and I met. We've actually met a couple times, and every time I meet with him, I'm just sort of blown away with how much he knows. And he knows so much about our healthcare system, how it's funded, how employers purchase healthcare. He has all these sort of like really incredible insights that he's trying to now spread this message that healthcare can be different. In fact, he's identified a healthcare system in the United States, which he'll talk to us about, that he calls the best healthcare system in the world. It already exists. And so it's become part of his mission to educate people about that. And so he's doing that through his conference. His background is super impressive. He has degrees in finance and healthcare administration. He is a Forbes leadership contributor and regularly publishes his articles in Forbes. So I've had a chance to chat with him a couple times, and Po, let me tell you, he's just genuinely kind and caring, and he's driven by this desire to make the world a better place. And he wants to do that by transforming our healthcare system. So I couldn't imagine a better guest to have on the Health Feast. I think it super aligns with our values and what we talk about on our show. So I'm really looking forward to having this kind of open, honest conversation with Darrell. I want to hear about his journey, the work he's doing with Orriant, and the Aspirational Health Care Conference. I think it's going to be insightful and inspiring, and I can't wait to see where the conversation takes us. All right, we're back. Darrell, welcome to the Health Feast. So nice to have you on as a guest today.
Thanks for having me. I'm looking forward to it.
Yeah, this is going to be a really wonderful conversation. So Po and I I was just telling Po all about you. And one of the things that it just really kind of resonated with him and then with me too was that part of your professional story, sort of how you got to be a hospital administrator, but then how you sort of pivoted from all of that. So I'd love for you to share that kind of professional background to start.
Sure. So when I was looking for a career, I liked the idea of healthcare, but I knew I didn't like blood. And I had a very close friend that was a hospital administrator that had just opened up a new hospital in the area. And so I remember having a conversation with him, and I loved everything about what he told me. However, he did say you have to be willing to travel, move. And that became true. But I then went and talked to like 6 or 7 other hospital administrators, and I really liked what I heard. So I said, okay, this is what I want to do. So I was at Brigham Young University, and I was trying to decide what undergraduate degree to get. And they all suggested finance. They said, historically, it's been clinicians that have moved into hospital administration, but the future is you've got to have more of a financial background. So I thought, okay, I'll get a financial degree. And they said, everybody has to get the card. And the card is a master degree in health administration. And of course, the big ones in the country are Washington, D.C. and Minnesota. And so I looked up their applications, and they all said, you have to have experience. You're not going to get in here unless you've got some experience. So I said, okay, I need to go get some experience. So I went down to the closest, hospital, large hospital next to Brigham Young University. And I said, hey, can I just take out your trash? Can I just get experience working in administration? They said, no, you'd be in the way. That was the best no I ever got, because I then went up to this small community hospital in the next town nearby, and I went and talked to their administrator, and I said, I just want experience. I'll take out the trash, whatever. And they said, oh my goodness, this would be so wonderful to have someone, because, there's just 3 of us trying to run this hospital. We've got more work than we can do. And we just bought this thing called the IBM personal computer. And we have no idea what it's going to do for us. But you could really kind of take that project on and figure out whether or not it could be valuable to us in running the hospital. So I got amazing experiences, both figuring out how to do Lotus 1, 2, 3. That was the originator before Excel, and how do you budgets on it? How do you calculate FTEs? And I got to work on cost reports, and I got to work on a renovation in the hospital. I had a wonderful experience. Because I was working so closely with this team, a new hospital came in town to build a new hospital. And they came to my administrator and they said, we want to recruit you to be the administrator of this brand new hospital. It was a psychiatric hospital, where the hospital we were working in were just a med surg small. It was a small, mostly a delivery and, labor and delivery hospital. And they hired him to be their administrator. And he comes to me and he says, there's 2 corporate officers running a hospital for this company. There's a CEO and a CFO. How would you like to become my CFO controller of this new hospital? I'm like, wait a second. I'm still working on my undergraduate degree. You want to give me the job that I want in 20 years from now, right now, before I even go get my MHA? Sign me up. So he gave me a tremendous opportunity to go right into the CFO's second position in the whole company, only 2 corporate officers in the company or in the hospital. And I'm being given the opportunity to do that. So instead of going off to some other MHA program someplace else, I'm like, I'll just work here. And Brigham Young University opened up a Master of Health Administration program at the exact same time with an option to go executive style. So that's what I did. I said, well, I'll just go to school in the evenings, get my MHA, I'll get my card, but I'm going to work. And so almost as soon as we opened that hospital, we decided to buy another hospital. It was a residential facility. And so here I was the controller of 2 facilities, and I'm just starting my master's program.
Wow.
Well, long story short, that turned into me running 10 different hospitals as either the CFO controller, assistant administrator, or COO, or administrator. And most of the time was for another company called HCA, the largest hospital company in the country. And as I would go I went from Utah to California to Texas to South Carolina to Illinois. So just like I was told, you're going to have to move a lot. I did. But it was during the time when the organization that all healthcare facilities kind of bow to, which is called Joint Commission.
That's right.
And so everybody's like, okay, you don't get surveyed by the government. You don't get surveyed by the insurance companies, but you do get surveyed every 3 years from Joint Commission. So that's what everybody bows to. And they were adopting new principles of Edwards Deming during that time. During the late 1980s, 1990s was when they were adopting these new principles of continuous quality improvement. And I became an expert at helping each hospital become accredited with accommodations using these new principles. Well, what are the principles of continuous quality improvement? It's who's the customer, define the customer. Then what's going to delight the customer? What does the customer want and how are you going to delight them? And now how are you going to monitor the processes that most impact delighting the customer? You can't monitor all the processes. There's way too many. But you do want to focus on the ones that affect delighting the customer the most. And then when you have problems, then how do you get the people closer to the process to improve the process, right? So there's CQI in a nutshell. And it was very, very difficult not to step back during those years and look at the entire industry through those same lens and go, oh my goodness, this has to be the most broken industry in America. Here I sit at the top of the food chain. I'm a hospital administrator, and I should be working for my customer. And if you really look at who pays for healthcare, it's largely employers who buy healthcare to attract and retain top talent, to create a healthy, productive workforce, and to basically have those benefits available. And it's like, how is it that I get away with scheming every day how to work against my customer? And how is it that my customer works for me? There's something wrong with this healthcare industry. I should be held accountable to work for my customer, but I'm not. No one's holding me accountable to work for my customer, and I literally work against them every day. And I said to my wife, I can't do this any longer. I can't dedicate the rest of my career to an industry who isn't held accountable to work for their customer, when in fact that's the principles I'm teaching. So I left the treatment side to really start to focus on the root cause of healthcare problems.
Wow. No, I was just saying, I appreciate you sharing your origin story. This is your origin story, right? Nowadays, everybody knows about the origin story, but this is what got you started down this path. For those that, like myself, that don't understand, what is Joint Commission? Sorry, I just wanted to put that in there so that others that are listening might have an understanding of what Joint Commission
means. It's called the Joint Commission on the Accreditation of Healthcare Organizations.
Okay.
And it's an organization, I think it's still headquartered in Chicago. It's an independent organization who surveys healthcare providers of any kind, giving them an accreditation. And because you have an accreditation, the insurance companies will pay you. The government will pay you for your elderly and your Medicaid.
Subsidized care.
So it's almost like you have to be Joint Commission accredited if you want to do anything in healthcare.
Got it. Thank you. I just wanted to clarify that for people that listen that might not understand what that is.
Darrell, you said something. Before you move on, I want to ask a little bit more about. You said that you're almost scheming against the employers, the customer. In what way did you see, like, what were some examples of how
Well,
you were scheming against them?
I held most accountable to? The thing that as a hospital administrator that meant the most to my boss, to the corporation who basically had me working for them, was bed count. It was all about hospital utilization. Was my hospital 100% full, 80% full, 60% full? That was my primary target, was to fill up my hospital. Well, what could possibly be working more against my customer than my entire job being to fill up my hospital? See, we build hospitals at the bottom of the cliff. So when people fall off, we can put them back together, making lots of money doing that. We're not incented in any way, shape, or form to put a fence at the top of the cliff. In fact, if someone were to put a fence at the top of the cliff, it would be my job to take it down. Because the only way I get to make money is when my hospital fills up. And that just didn't feel right.
Wow. What happened during that time? Did you just wake up one day, or did you see it through time? Like every day you're like, wow,
Yeah.
you kind of uncovered this, I don't know how to explain, like how to express it. Like this thing that you realize, like when did it switch in your mind? Like, wow, I'm part of like the problem and not the solution.
So clearly training everybody on these Edward Deming philosophies of continuous quality improvement were very instrumental to that. But it was also the fact that most of those hospitals were psychiatric hospitals. So of the 10, 2 were med-surg, 8 were psychiatric. So let's talk just a little bit about the purpose for a healthcare system. If the purpose of a healthcare system is to create diagnoses and treatment plans, meaning to deliver medical treatments, then it is in my best interest to do as many of those as I can. And if that's what the customer wants, that's what I will sell. And right now, the customer doesn't demand what they want, meaning the employers, and so they're willing to simply pay for insurance to cover the cost of medical treatments. But if the goal is to create health, then all of a sudden you have to realize that there's something more important than medical science, and that's called behavioral science. Medical science is the root of how you diagnose and treat patients. But behavioral science is how do you influence behaviors, whether it's to treat mental illnesses or whether it's to create health. But if your goal is to create health, you have to put behavioral science in front of medical science. And the best healthcare systems in the world have figured that out. And so here I am working with counselors and social workers and therapists. That's who I'm working with in these psychiatric hospitals. And they get behavioral science. They understand it. And I'm like, why is it that the only people that get these incredible skills applied to their situation of changing behavior is only for the people that are diagnosed as mentally ill? When in fact, the entire healthcare system, if its goal is to create health, should be built on a behavioral platform. And a behavioral science should become first and more important than medical science. Why? Because we control our own health. There's only very few situations in healthcare where the healthcare system takes a comatose patient and does something to them. The majority of healthcare should be all about influencing people to change behavior so that the medical treatments that we're bringing to the table work. But very little of healthcare is first and foremost medical science. It's really first and foremost behavioral science. And so the best healthcare systems in the world have figured out that to really create health, primary care physicians, even though they go through all the medical science training, the most important training they get is how to influence behavior, how to do motivational interviewing, how to do empathetic listening, how to really engage in a trusting relationship where you understand the goals and the aspirations of the patient individual. And then you weave into helping that person reach their aspirations the medical treatments that would help them accomplish that. Does that make sense? So I left the treatment side of healthcare to build one of the very first health coaching companies in this country. Health coaching wasn't even a term. We made it up. And we found within a few years, other people were using it as well. But the idea of actually focusing on behavior and not necessarily using expensive MDs to do behavior because, they're trained in all the medical science. Why not use a less expensive person who's very well trained in behavioral science to work with primary care and engaging people, not based on what you want them to do. I want to make this very clear. You cannot apply best-in-class behavioral science and say, this is what I want you to do. Here's how I'm going to get you to do it. That is not the best-in-class behavioral science. Behavioral science teaches us that what you have to do is find out through a trusting relationship what the person wants. And then you help the person accomplish that aspiration through applying best medical science to get there. Make sense?
100%. Yeah, I understand that. Go ahead.
Poe
Go ahead.
Poe's nodding. No, I'm just saying, Poe, you're nodding because we talk about this a lot, and this I know this resonates with you.
Yeah, I've mentioned it before that sometimes, going to my doctor sometimes can be very transactional. Like you're in and out. Like I know that he has to see X amount of people, so I got my allotted 15 minutes, and let's just hurry up and get this over with. And I also notice it's a lot of like pills being thrown versus like maybe more holistic ways that are like or some type of other methods that could help me get better. And even though I trust them, but over a long period of time, it's like it's not so much about developing like this sort of ongoing thing, this ongoing sort of relationship with your doctor where you actually feel like he's invested in you or he or she is invested in you for your overall well-being. And I always talk about Rak and I was like, man, this is the type of like our kind of relationship with each other. That's what should be the type of relationship that you should have with your doctor. Rak checks. And I know sometimes because I feel like in the future it will be. That's why I'm so excited to have you.
Can I tell you that there actually are healthcare systems in this country and in the world that actually work that way, and they're the very best healthcare systems in the world.
Yeah.
Wow.
You want to describe?
Yeah. Can you talk about that? Because like I had no idea.
So I was telling Dr. Rak a few days ago that one of the most inspiring business case studies in any industry is this group of Alaskan Native people up in Alaska who 20 years ago were given the opportunity by the federal government to leave the federal Indian healthcare system. And were given the opportunity for their 65,000 members to build a brand new healthcare system. And they did something that nobody else has ever done in healthcare. See, the way healthcare generally works is we're the institution of medicine where all the wisdom lies. Come be the benefactors of our great wisdom, and we will fix you when you break. That's how healthcare works. Well, they had the insight to apply Deming's philosophies of continuous quality improvement, and they said, why don't we ask the customer what will delight them, what they want? So they spent like 4 to 6 months with these researchers, and they went out and they asked their tribal leaders and the actual members, and they said, what do you want from a healthcare system? And what they heard was, we don't want a paternalistic system that just tells us what to do. We want a healthcare system that journeys with us through life, on our path, through our journey, helping us reach our life's aspirations. And so they went to their current medical staff and they said, we're going to build a healthcare system based on what the customer wants. And what do you think the current medical staff said? We don't know how to do that.
We don't know how to do that. Yeah.
We were trained to diagnose and treat problems.
Yeah.
So they let them all go. And they started from scratch, and they made this amazing architecture of a healthcare system. They call it a massively powerful primary care system, where they took a team of a primary care physician, a nurse case manager, a medical assistant, a scheduler, and they said, look, You 4 people are going to be assigned to these patients, these members of our population. So they took their 65,000 and they divide them up into these groups and they said, okay, this team is your team. Now, team, your primary role, literally primary role, is to be their coach, to get in a trusting relationship with each one of those people to help them live life to its fullest. And because you now have built that relationship, when something does happen and they fall and skin their knee, or they fall off the cliff and need more serious health care, they're going to call one of you. They're going to have access to your phone number, and you are going to make sure that they get the health care they need and coordinate the care at all levels, regardless of what level they need to get health care at, and get them back on their journey, and you're going to stay in touch with them so you can help them live life to its fullest. Now, 20 years later, they're the only healthcare system that's won the President's Malcolm Baldrige Award for Quality twice. They're recognized around the world as the premier healthcare system in the world. They reach patient satisfaction of 98%. Their employee satisfaction is 93%. They've moved their entire population, which used to be one of the worst health populations in the world, and scored less than 5% on all HEDIS scores. They've moved them over 20 years to now in the top 75, and in many cases, the top 90% of all HEDIS scores. And they do it for half the price.
Wow.
It's like we don't need to hope that someday somebody figures this out. In fact, when I visited them the first time a couple of years ago, I said, you're willing to share all your secrets with everybody. This is amazing. You don't hold anything back. Who comes to your conferences? Well, Singapore, who's often considered the best healthcare system in the world, they came and mirrored their program after the Nuka system. Sweden, Finland, the Polynesian Islands, European countries, Canada. I said, does anybody ever come up from the lower 48? Yeah, no, not very often. The misalignments in this country's healthcare system would prevent anyone from wanting to learn how to do healthcare right. It's all about the more services we render, the more money we get to make. So one of my passions is to wake up the customer, business leaders, to the fact that you're buying a bad product at a bad price. And you're not holding the healthcare system accountable to give you what you want, which is to attract and maintain top talent, which is create a healthy, productive workforce. It's like you're not holding the system accountable to create health. Hence, it's making money just doing medical treatments and buying insurance that pays for it.
Who's the one that suffers the most in this entire process, in your opinion?
Well, did you know that medical errors is the 3rd leading cause of death in America?
No. Wow.
So right off the bat, people are not only suffering death because of medical errors, but their families are suffering from the consequences of those medical errors. Because the healthcare system is built on creating and offering medical treatments, not producing health.
Wow. This is some like such important information that in this 20 minutes that we've been on here, I'm just like, I'm blown away by this.
Blown away.
I mean, I completely oh my gosh, how does one, I'm just assuming that, there's a lot behind this, there's a reason why the normal person doesn't understand or even see any of this information. Do you think that would cause a mass shift if the American people, and not just American, but just general, the whole world, and when they understand that this is how the system is designed, do you think there'd be some changes being made?
The customer has to drive the change. Because as long as our current system is built on just turning it over to everybody else and never defining what they want, see, I really truly believe that it's not about a single payer system, and it's not about the current capitalistic healthcare system. It's a whole new emerging system called aspirational healthcare, which is all about alignment, choice, and relationship. And the first one is so fundamental. Employers buy healthcare benefits for their employees. But what they never do is sit back and ask themselves why they do it and what do they want. I have the opportunity as being one of the top speakers to CEO groups across the country. So Vistage is the leading CEO coaching program across the country. And I'm the top speaker to Vistage groups. And I love to get in front of a group of CEOs and say, why do you buy healthcare? And they look at me like, I don't know. I guess because I have to.
Yeah, I have to.
And I say, I get you for 4 hours. So I'm going to ask you to think a little bit stronger because believe me, you would be a whole lot better off. Instead of paying on average $14,000 per employee per year like you do, pay the $2,700 penalty per employee. If all you want to do is be compliant, pay $2,700 to the government as a penalty and walk away from healthcare. You'd be a whole lot better off saving a ton more money to let the government pay healthcare for your employees and pay the penalty than to be spending $14,000. And by the way, that's not the additional $6,000 that the employees are paying. That's just the cost that each employer is paying.
Wow.
So think about it and decide, why do you buy health benefits? You've never even thought about it before. So start thinking. I get you for 4 hours. And it's amazing when you get a group of CEOs to think about what is it that they really want? What's their aspirations for why they spend this money? Number one is always to attract and maintain top talent. The second one is always to create a healthy, productive workforce because my product is better when my employees are healthy and productive. And then, of course, they always say, I wish it cost less. But I say, okay, so who do you hold accountable? Do you measure to see how well the money you're spending is actually accomplishing the things you want? No. Are you holding anybody accountable to get what you want? Does your HR director or benefits manager get a bonus if you're effective at creating a benefit plan that attracts and retains top talent or that improves health? No. What about that consultant who represents you to the healthcare industry? That you wrote a broker letter of record with this consultant, and now they're your face to the entire healthcare world. Are they aligned with you to help you accomplish what you want? Oh no, actually, they get to make more money when you don't get what you want. The consultant makes more money when you get to pay more for healthcare. So who's going to give you what you want when no one's aligned to help you get what you want? I was talking to someone last week who gets in front of large groups, and they said, I love to ask a group of employers, how many of you are in the healthcare industry? And about 20% of the people will raise their hand. And then they'll say, how many of you offer benefits to your employees? Everybody raised their hand. They said, well, let me suggest that Warren Buffett was right when he said that General Motors is in the healthcare industry and they build cars on the side. Because that's the case. You can't ignore the fact that you're all in the healthcare industry. It's your second or third largest cost of doing business. And your lack of holding the system accountable, your lack of measuring to see if you're actually accomplishing your business objectives is the root for why we spend $2 trillion more in this country buying a bad product than we should. We could put $6,000 every year back into every citizen in this country's pocket if we could just drive the system to be focused on what the customer wants instead of having the customer work for the industry.
So how do you, when you're meeting with an employer group and you tell them this and they have these, these revelations about what healthcare should be, then what do you tell them? Like what's their actionable step?
It's really quite simple. It's about spending their money differently. Right now, employers go, oh, I guess I better allocate a budget for health insurance. So they say to their benefits people, go pick one and go sign a broker letter of record with somebody that's going to bring you options. And I say it's really about alignment, choice, and relationship. So align the system to give you what you want. Define what you want. Doesn't take a lot of work. Doesn't take a lot of time. Sit down and decide what you want. What are your priorities? Create a way to measure and monitor to see if you're getting that. You guys all measure your net promoter score from your customers. Why aren't you looking at your employees as a customer and finding out what's the net promoter score on the benefits you offer from your own employees? And then hold the system accountable to actually drive up that net promoter score. So alignment is number one. If you don't do that, the healthcare system is going to keep working against you. Nobody's aligned to work for you. Everybody makes more money when you don't get what you want. The brokers, the insurance companies, and the healthcare providers all make more money as costs go up and you don't get what you want. That's not their fault. The fault is the business leader who allows it to happen and isn't holding the system accountable. So alignment is number one. Number two is choice. When I ran hospitals, why do you think I bought primary care practices?
I don't know. Have more choice of doctors for the. I don't know. Actually,
who's the only one that can admit to my hospital?
The ones that are in your network.
Well, an individual can't admit themselves to a hospital. It takes a doctor.
Oh, the doctor. Yeah, right. Yeah,
so
doctors.
The reason I bought primary care practices was to ensure that there was a funnel source into the broken system. If I can charge $5,000 for an MRI and the imaging center across the street charges $500, how do I make sure that they're being referred to my $5,000 MRI instead of over to the $500? By buying the primary care practice and keeping track of their relative value units every day to make sure that they're sending their patients into me. That's why I bought primary care practices, is to control the funnel source. So as an employer who's offering health benefits, I want to put my money into 4 separate buckets. Right now, I put all my money into a health insurance plan. Big mistake. Why? Because that health insurance plan is driving everybody to a primary care physician who's aligned to refer them into the broken system. So if I want to change the front door, and I know I'm trying to create employee satisfaction, I can't force them into a new primary care provider, can I? But what I can do is I can say, I'm going to give everybody $50, let's say, $100, $75, $25. I'm going to give you money if you're willing to sign up for a subscription-based advanced primary care practice where relationship is important. We're actually creating a relationship like Dr. Rak does. How I want to put money into a bucket that you can use to sign up for a membership where primary care is simply offered on a membership basis, not through insurance. The doctor's not billing insurance. They're just receiving a membership from every employee or every patient every month. So I'm going to put money aside there. And if you'll sign up for a subscription-based primary care, great, you can use that money to do it. If you only want to continue using the broken system, fine, but you don't get that money. That money is earmarked specifically for a new front door to healthcare. Now, if every primary care physician was trained on how to be a good coach, we wouldn't need the third bucket, but they're not. And the third bucket is an incentive to engage with someone who's going to help influence you based on your goals and aspirations to reach your goals and aspirations. And in the same process, become healthier, like a coach. So I'm going to give you an incentive to work with a coach. You don't have to work with a coach, but the only way you get the incentive is to work with a coach. And then the third bucket is medical cash. And we won't go into all the details of how to best do that, but I love the EBHRA. It's the most versatile account out there. So we're simply teaching employers that stop putting all your money into this one basket that's broken. Give your employees choice to make choices that are going to build an aspirational benefit model where now it may not be as perfect as the Nuka System of Care in Alaska because they've got 20 years of really integrating all this, but it's going to be a whole lot better than the current system. You can probably get 98% of the way by just putting your money for your employees to use in a different way. It's all about how you spend your money. Does that make sense? And then the third one is relationship. I want you to have a relationship with your primary care provider where they know you and you know them. I want you to have a relationship with a coach who's going to influence you and know what your aspirations are and help you get there. I want you to have a relationship with an advocate, a concierge navigator who's going to help navigate you through all the complexities of healthcare and take all the worry of payments off the off your lap. And as long as you have those three relationships, you can sit back and not worry about healthcare. Just worry about reaching your own aspirations.
Yeah, sign me up. What do I? Because I feel like this is something that's missing. Yeah, like I'm totally kind of inspired by this because I feel like this is something that this is exactly what I was talking about to Rock. I was like, man, why does it always feel like, going in, it's like there's like a disconnect there, when you go to the doctor's office. And I mean, we were talking about this before too, about how, like, if you think of all cultures had someone that was well versed in medicine and they were part of the village. Like, I'm Polynesian, so they were kind of like medicine men, right?
Yep.
Right.
Yep.
Where did we lose that? Like, all of a sudden, we lost that person was sort of like the focal point that you would always, they were the neighbor. They were your neighbors, you could go there and seek some help, and you knew that they were giving you that sound advice, and they also had your best interest in you too. So I like this. And I'm surprised that is it growing? Like, is this something what have you found are some of the challenges right now?
Yeah. The only challenge is just letting employers know that there's a different way. They're so caught up in running their business, and they've given this entire responsibility over to HR and benefits and a consultant who are all not aligned to help them reach their business objectives, that there's the big disconnect. I mean, literally, therein lies the disconnect of why we spend $2 trillion in this country towards an industry that is made up of middlemen who are just stealing money out of the American pockets. People think, well, if we were to drive healthcare down half the cost, we wouldn't have as much money going to the providers. Absolutely not. Only 27% of the entire bill for healthcare goes to doctors and nurses and providers. Almost 50%, 47% of healthcare is unnecessary overhead and waste and fraud and abuse and this whole third-party payment system. It's like, the majority of healthcare isn't towards giving healthcare. And that's what we need to wake up people to, is you're buying a bad product at a bad price. And systems like the Nuka System of Care have proven that you can take the entire system, build it on the back of relationships and behavioral science, and you can create better health, better satisfaction, better results at half the price.
I love that you're empowering the customer, as you said, the employers, like that. Traditionally, I've thought so much about how to change healthcare. When I was before medical school, I worked at a not-for-profit that was trying to get, as you said, single payer. Po, that's what they have in Canada. There's only one insurance for the whole country, and that is the government. The government is the insurance company. So there's private hospitals and doctors and whatnot, but everyone gets paid the bill from one person. And you said something really interesting, Darrell. You said it's not even that. It's never mind single payer, because that's entrenched in sort of this current system. You're paying for care, for procedures. So when you describe like building a new system, first of all, I love that. I mean, that's how you found us, as Po and I were describing what we called an aspirational healthcare system based on relationships. I don't know how, like, closer, the universe was like, Darrell needs to see this. And then you went to our website and reached out to us. Po, in that conversation, you said something like, oh, I feel like we'll see that soon. And I said, I hope so. I love having these conversations with you, Po, because you're optimistic. But then sometimes it just, like, working in that system, like, it just feels like there's so many forces that are trying to keep the status quo. So what, Darrell, like...
Can I take a little bit about the government?
Yes.
I won't go into the whole history, but the reason employers are even involved is thanks to the government. At the end of World War II, the War Labor Board basically put a freeze on salaries, and the next year the IRS said to employers, you can offer health benefits as a tax-deductible benefit to attract these employees and these GIs coming back from the war, but you can't increase salaries. So that's how healthcare got into the employer space in the first place. And once it got in, it's like, it's going to stay there. But the government over the years has done some really, really unaligned things, because it's someone using someone else's money to pay for someone else. And that just doesn't have the alignment that you need.
Mm.
Where it's interesting, when the Affordable Care Act came out about 2010, I remember hearing about the fact that the government wanted healthcare providers to group together and create these accountable care organizations, ACOs.
Right.
And I said, oh my goodness, you mean the government's actually going to get smart and figure out how to tell healthcare providers, like, okay, you're going to take responsibility for health. Like, your job is to really create overall health and take full risk to producing that health. And as I read down through the 814 pages of the ACO part of the regulations, I got to like page 400, and it says there's two ways that ACOs can get paid by the government. And they get to choose which one to take. There's a value-based fee for service reimbursement structure. And then there's this full risk structure. So if they take a flat amount of money for every person who joins the ACO, and they take full risk, if they lose, they lose. If they win and they can become profitable, they have to give most of the profits back to the government. And I went, there's no way anybody's going to take risk without the reward.
Right.
Who's going to be dumb enough to do that? So what did all the ACOs do? They went to value-based reimbursement. Now I have some good news to tell you. Some have figured out how to work around the government. So, for example, Humana is a large insurance carrier that's been in the both Medicare supplemental space as well as the commercial space. Well, they're leaving the commercial space. And that's because they figured out how to do the senior space, the Medicare Advantage place. And here's what they figured out. After they've got the money from the government, they do what the government should have done. What they're doing is they're taking the money from the government for every person that signs up for Medicare Advantage under Humana. Humana then is passing on that money, or most of it, to these innovative medical providers like ChenMed and CenterWell, who have figured out that through relationship-based, behavioral-focused healthcare, doing exactly the same model that the group up in Alaska did, they can actually get in front of healthcare problems, avoid hospitalizations, even take on the worst risk population in our country, the seniors with the most chronic conditions. And by using the same approaches that Nuka took, of building relationships with each person, meeting with everybody on a regular basis, building those relationships, they can avoid like 50% of all hospital care. And they're making money, they're making profits on the fact that they're taking the full risk. They're primary care providers, but they're literally taking the risk for all healthcare. And they're figuring out that the best way to do that is what I was hoping would happen back in 2010. But it's now taken people to figure out how to work around the government to actually do that. And here's part of the problem that I see. You've got some people in Washington that have a real problem with doctors making 20 to 30% profit. And I'm like, okay, let me just tell you how I see this. What if we could figure out through a group of really innovative healthcare providers how to eliminate all healthcare problems? Everybody just lives to the age of 92 and then drops off and dies in their sleep. We never had a hospitalization. We never had medication. We never had anything. And we paid all the providers in this country $2 trillion to figure out how to do that. And we saved $2 trillion. And all of that $2 trillion that we paid those providers was all profit. Would that be a problem? Would we really have a problem saving $2 trillion and putting it back into our economy in productive ways if all the healthcare providers in the country got to make $2 trillion all in profit because they figured out how to completely eliminate healthcare problems? Really? Would we really argue?
Right.
So
yeah,
I'm sorry, but when people are elected politicians, largely by the biggest lobbyists in the world, in this country, which are healthcare lobbyists, they're not in a position to drive healthcare to follow the best healthcare system in the world, which is right here in this country.
What keeps you motivated and inspired to do this when you're...
Well, every time I learn about a new program like ChenMed or CenterWell, there's another group called People One Health up in the Pittsburgh area that's doing a very similar thing. Redirect Health is doing similar things. I mean, we've been doing as Orriant the coaching part of this for 27 years. We've proven you can improve population health by just giving everybody a coach and getting everybody engaged in a relationship-based coach. So it's discovering the fact that all those things that I believed back when I left treatment side of healthcare are true. That's what keeps me passionate. It's like, see, again, over and over, we're discovering that it's all about alignment, choice, and relationship.
Yeah.
Man, thank you. Yeah. I was going to ask you, like, for us that are still in I'm just going to say the traditional system, what kind of advice could you give a customer or a client that's still in the traditional system, but I'm aware of like this other form of healthcare?
The best thing that individuals can do is go to their employer and simply say, why in the world are you paying for traditional healthcare insurance for me when you could be spending a whole lot less on an aspirational health plan? That's all employees need to do, is just go to their employer and say, why are you spending twice as much money as you should be and just go to aspirationalhealthcare.com and learn all about this new model. That's all it takes.
Got it.
Right. Yeah, that website is full of, I've explored it quite a bit. It's full of a lot of recordings and interviews, I guess, from, you've had now 2 years of conferences.
Mm-hmm.
You talk about that, like this, and this has become clearly this is your life's mission and purpose.
Yeah.
Right. That I feel that very strongly, that how that's come to be, you described really beautifully.
Right. So when I learned about the Nuka System of Care, the best aspirational model in the world, and they're the ones who came up with this term, aspirational healthcare. And I learned that nobody from the lower 48 ever goes up to learn about it. I'm like, okay.
That's crazy. Wow.
I've been the top speaker to CEOs across the country on healthcare and how to spend money. I'm going to use my influence and all the connections that I have to drive this message forward. Employers just need to know what they don't know. And so we've held 2 conferences these last 2 years where I just bring in, and the folks up at Nuka are more than supportive. I mean, they love the fact that others can learn from them. They have no intention of selling their services and having more people just buy healthcare from them. They'll sell their consulting services, but they're also willing to give a lot out for free. I mean, you go to their conference and you learn a lot. But they're like, Darrell, go for it. If we can help you drive this model across the U.S., that would make us extremely happy. So, we've created this aspirationalhealthcare.com website. There's a company called Aspirational Healthcare BLLC. It's a social impact company with the mission to drive healthcare to be more health related. And they've been very supportive on our conferences to participate in those conferences and tell their story. But we've also had other innovative groups across the country tell their story and how they're moving this forward as well. So we have an Aspirational Healthcare Employers group where employers can learn about this, and those who have done it can share. We've got an Aspirational Healthcare Providers group, so providers who offer the ecosystem can work together. We have an Aspirational Healthcare Advisors group where over 50 consultants across the country have joined this group to be a part of an effort to really change the way consultants, instead of working for the broken system, are now working for the employer. And we've got an Aspirational Healthcare Journalist group where we've got people from the media that are meeting together to say, how do we get this word out through the media? I mean, journalism is kind of the foundation of democracy. In my mind, it's like, we just need to tell the story.
Right.
Are there any? No, I love that you said that you have consultants who now are sort of almost getting retrained, where they're now going to be aligned with the goals for the clients and the goals for the and we now have an actual credentialing process, a course that's both interactive as well as watching things. But
where consultants can actually be certified as a certified aspirational health care advisor, CAA. So when employers learn about us and they want to connect with a consultant who really understands how to implement this, they can reach out to someone that we can refer them to who knows how to help them implement it. And the implementation is not hard. The biggest part of implementation is the fact that it's a change. But here's what we've learned about implementing change. We like to survey employees at the very beginning to kind of get a benchmark. And then we measure over time how well, again, the business objectives and the aspirations of the employer are being met. Well, in that initial benchmark survey, we also ask, who do you think in your company has your back? Who do you trust? And so for each location or general group of employees, we're identifying a trust capital group that this is introduced to first, with the idea of help them understand this is a whole lot better for individuals. And it's not just a change the employer's making to save money. It's actually better for everybody. And then they help design the communication strategies to let everybody else know.
Yeah, it almost seems like we need an alternative to insurance, or a new type of insurance that basically fills all those buckets, right?
Which is what the aspirational plan is. I mean, it's basically, you still need something for catastrophic care.
Right.
But stop putting all your money in that basket. That's the problem, is we just go buy insurance and say, okay, how come it doesn't work? It's like, well, it's not going to work.
Yeah.
You have to put your money into those other buckets to make it work.
I'm thinking from medical training perspective too. It sort of has grown up with the financial aspects of the healthcare system. So there's a lot of emphasis there's no emphasis on the things you talk about, like motivational interviewing and forming strong relationships for behavior change. There's a lot of emphasis on diagnosis, and then managing illness, I would say, is sort of the why. Because when you manage illness, they become dependent almost on you, right? That's the truth. And so, in the truest sense, an aspirational healthcare system almost it removes the need for such a large healthcare workforce. I mean, that's the truth, right? We have such a huge shortage of nurses, of everything now, right? Nurses, therapists, physical therapists, you name it. And so, not that, there won't be a need for healthcare in the future, but I see sort of a redesign. So many people go into subspecialty care these days. Why? Because there's a financial incentive to do that. And we need, more than this, we need, what did you call it? The primary care?
Oh, massively powerful primary care.
Massively powerful primary care. That's what we need in this country, in this world. And you mentioned some examples. I'm familiar with ChenMed. I'm not as familiar with some of the other ones you said, but it sounds like more and more are popping up.
Well, and what's amazing is that they're actually, if you read The Calling, which is the book about ChenMed,
that's right.
They talk about the fact that, normal doctors go through this education process and then they get out and they diagnose and they treat. And they said, if you want to come join ChenMed, you got to go through a whole other set of training. We literally put our doctors through motivational interviewing, empathetic listening, and training them how to be a coach. And it's like, you don't get to be a doctor for us until you realize that really, if the goal is health, behavioral science is actually more important than medical science.
That's right. They do a whole year. They do one full year. This unique primary care company. Now they have, I think, locations in 14 or 15 states. They've spread quite a bit, and they're at this point, right, really focused on that senior population, Medicare Advantage population, right? Because there is that insurance company like Humana has figured out, okay, we can financially incentivize health in this way. And so I wonder what's the sort of, that's what you're describing. The bigger transformation is for all employers to sort of say, no, we want to incentivize health for our employees. And then maybe one day there'll actually be like that. That'll be the product. Like it'll look like that, right?
Well, and I love to tell the story of having gone to the Nuka conference last year. Imagine going and spending a week at the best healthcare system in the world and learning from them the golden nuggets of how to produce the best healthcare system in the world. Well, the first 3 days, first full 3 days, is nothing but going through the very same, they call it core concepts training, that every employee who goes to work for Nuka has to go through. And then they have to re-go through similar trainings. But those first 3 full days is learning how to build trusting relationships through storytelling and how to appropriately respond to storytelling and communicate in this empathetic relationship trust building environment. So imagine if you're going to go to the best healthcare system in the world, you'd think you're learning about their best technology to handle cancer and best technology for medical bedside care and all these different things. No. 3 full days on simply how to build trusting relationships.
It's incredible.
I mean,
Isn't that incredible?
it really is. Yeah, 100%. I think it's like connecting with people again, like it's something that I think we've all have. I think it's always been there. It's just somewhere along the way,
Lost it.
We completely lost it, man. And I think the money became more important than the connection with the person, So I feel like I'm really excited. I always am very I think that's going to be the future. I mean, it might not look like it now, but I feel like, and we're already in it. You're saying that they've been doing it for 20 plus years now.
Yeah.
Was it Nuka?
Nuka?
Yeah. And I feel like it's something that, I think it's going to continue to grow. I mean, I was just talking about specifically, like when I go in to see my doctor, like what do I say to them about this? Do I suggest it to them like, hey, have you ever heard of Nuka Care? Or cause that's where it starts, right? It's just starting the conversation with your doctor. And
well,
for those who are listening,
it starts with your employer, because imagine if your employer were to hand you, let's say $50 every month for you to then go subscribe to a membership-based advanced primary care provider. Now you may have to change the current doctor you're going to, but you could today go find in your area, and they're all over the country, a membership-based primary care, they call them direct primary care provider, who you would immediately have this kind of relationship with. And what we need to do is get employers to say, I'm going to actually give my employees money to go do that, because I don't want them using the primary care that comes through their insurance. But I'm going to let it be their choice. So if you can get your employer to actually allocate their money, then you're not having to pay for that. Now, if you can't, then you can just pay every month to have a subscription-based primary care doctor involved in your life. That will be I do. And it's amazing. I have a program where literally I have a relationship with my primary care provider. She has a relationship with me. I know I can schedule an appointment today or tomorrow. I can be having a virtual conversation within a few hours. I can go over what I need to go over. If they need to see me in person, they come to my home.
Wow.
They knock on my front door. They pull my labs. They do my x-rays at my home. And all of that's free. And they even provide medications that are free. All I pay is a small amount of money every month to have my whole family covered under this. I pay $4 a day, less than $4 a day for my entire family to have access to this kind of healthcare.
So let me ask you this about for those who are working for big companies, like for me, I'm a state worker or government workers that have, or let's say, for example, your wife works for a medical company. Like, how do we manage that? Like, for me, I don't even know where to start to reach somebody. Maybe my union. I'm not sure. Probably my union would be probably where I would start. But
yeah, if you're a part of a union, the unions have a lot of voice. Unions should be demanding aspirational health care benefits for their union members.
Got it. Okay.
But even if you're working for the government, here's what's interesting. Your HR department will listen to you far quicker than they'll listen to somebody knocking on their front door. The most impactful group across this country are people like you. hearing this message and simply going to their employer and saying, why in the world are you offering me deficit-based transactional healthcare?
Got it. My
Darrell,
wife, she works. Go ahead. Go ahead.
No,
Rak.
go ahead. Yeah,
No, it was just a comment. It was just a comment. Go ahead.
Okay. I was going to say, Darrell, a lot of people get their health care actually through government benefits, right? Either Medicare and you talked about these kind of unique Medicare Advantage programs, but also Medicaid. Are there any examples of Medicaid, for example, programs in various states that are utilizing aspects of this or that you're
So
aware
I
of?
know that some indigenous tribes across the country have gone up to Alaska, learned from Nuka, and then implemented similar programs in their areas. And I know that in some cases, Medicaid is involved in trying to reimburse some of that. But I'm not aware of it any more than that. But I think it would work. I
Yeah, I
mean,
think it would work.
Medicare Advantage is showing that it's like you pulled the rug out from under the ACOs when you basically said, if you make any profits, you have to give it back to the government. Like you took away the very incentive for entrepreneurs to figure out how to
Right.
solve healthcare.
Right.
I mean, the world I work in, right? I'm certified in lifestyle medicine. My company doesn't actually provide primary care services, but we do take insurance, and we're sort of like seeing patients and really trying to. I almost think like we're patching up the current healthcare system. But what you're describing is aspirational and probably where we need to go. And I think it's just a matter of time. I mean, if the cost benefits are there, and now there are actually examples of people saving money, it's only a matter of time before I would think. I don't know. How do you look at the kind of future landscape, Darrell, and like what do you envision
I truly
the world
believe
of
that we'll get
healthcare
enough
changing?
employers to do that, to do this, and show that instead of spending $14,000 per employee and asking their employees to spend an additional $6,000 to have a deficit-based transactional healthcare system, and they can spend half that much, I mean, literally $7,000 per employee, and through new cash pay strategies, not charge the employee anything, no
Hmm.
premiums, no copays, no deductibles, no out of pocket maxes, no EOBs, spend half as much as you currently do, and have it be an aspirational model. It's only a matter of there's going to be a certain number of employers that do it, and it's going to just grow like wildfire. Because, like,
Yeah.
why would we keep doing what we do? Why are we spending $14,000 of our money, expecting our employees to
Yeah.
pay $6,000 of their dollars for a transactional deficit-based healthcare system where no one has an incentive to change anything? Brokers don't have an incentive to change anything. The
Yeah.
insurance companies can't change anything, or their shareholders would be up in arms. The healthcare insurance industry that we think is holding the healthcare system accountable, ever since the Affordable Care Act, the only way health insurance, for-profit health insurance companies to make more money is for costs to go up. If they were to drive down costs, they would make less profit.
Hmm.
Thanks to the government and the way they implemented the 80-20 rule in the Affordable Care Act. So it's like nobody in the system is incented to change anything. That's why we have to wake up the very one person who should have an incentive to change things, which is business leaders.
Yeah. There are some examples of the government now experimenting with full risk and like reward in these kind of value-based care models, right?
And the
I don't know
more
if you
those
can.
grow, the better.
Yeah. Yeah. Yeah.
When
If
it's a
there's a political
value-based
will.
reimbursement program based on the more people that get sick, the more money we spend, that's not a good thing. When
No.
it's a value-based
Right.
care based on we're going to spend this much money, but now the population is going to get
Right.
healthier, that's what we want.
That's right. Thanks for making that distinction. I worked for a large healthcare organization for many years that touts that they're value based, and every day or two, I would get an email asking to code for illness because they get paid more when there's more illness. And there was this disconnect. It was like, well, if I reverse disease in this person, oh, you're going to get paid less. Maybe that's why there's an incentive for me not to reverse disease. I know, bro, you're shaking your head. I know.
Crazy, man.
We're just taking the.
I mean, it's like, man, it's like a guilt laugh. Like, man, this is crazy. Like, I've knew about this before, but like to hear it, it's just like, man, it's even more like it's just wrong. But I'm glad there's a solution. See, that's the thing. It's one thing to feel like, oh man, there's nothing I can do about it. But now that I'm talking to Darrell, it's like, wow, okay, so if I can just make some suggestions, or go to my employer, or I don't even know how to like talk to my doctors about this, like my actual doctor, and like suggest taking a look at this. Now, this membership based subscription, is that Aspirational Health? Is that the actual company that I can team up with or is that a different?
No, we can refer you to but there's a lot of vendors across the country who offer direct primary care on a subscription basis. For example, Walmart Health is a great example of an organization that's now blossoming this across the country.
That's right.
There's Redirect Health. It's an entire health plan that individuals can sign up for that's based on this direct primary care. And there are just tons and tons of direct primary care practices popping up all over the place. And what I'm saying is employers drive that demand by allocating how you spend your money. There's no question that the supply will come. There'll be more and more physicians who want to practice under this model. It's a whole lot better to work under.
Yeah, that's right.
Amazon bought One Medical. Why did Amazon buy One Medical? Because One Medical is probably one of the largest organizations of this kind of a model across the country. So you've got major employers like Walmart and Amazon that are investing in this new model because they see the future of where healthcare can be.
Yeah. In some respects, it seems like if there was a political will, or like with the strike, just like you mentioned in the ACA, like that created this incentive for the system we have now. Like if health was incentivized, like everyone in every healthcare company would be like, oh, our new strategy is to figure out how to, and then they'd quickly realize like, oh, everyone needs to be trained in behavioral health and coaching, and yeah, we'll get there, I guess.
Well, and let's talk about mental health for just a second.
Please.
Sometimes we want to put mental health in its own silo. But really, mental health is just a part of behavioral health. And I think the statistic that people don't realize is that people wait 10 years on average after mental health symptoms appear before they reach out for help. And only 40% ever reach out for help, which means the lion's share of people that are experiencing mental illness symptoms aren't getting any help. So if our healthcare system was built on a behavioral science framework, where building relationships with people was the foundation, we would be addressing emotional and mental health issues way earlier, and we would be getting people who can help them way before it became a diagnosis. Wow. Where we can address, you should go up to Alaska and visit the amazing model they created, because every primary care team has this secondary team around them, one of which is a behavioralist. And so behavioralists get involved in almost every visit with every patient, because there's a behavioral aspect to almost everyone's condition and everybody's situation. Wow. So when you bring behavioral health as the basis of all healthcare, it's amazing what you can do for mental health.
That's incredible. Yeah.
Wow. I'm getting chills because I think about this all the time. And I've done all this, my own training. I had to do on my own, figure out like, how do I get this behavioral health training? And that's not true, actually. I got motivational interview training in residency because I was involved. I was in a health disparities, health equity track at University of California, San Francisco. And part of that was motivational interview training, specifically because we were working more with populations with larger amount of substance abuse issues, right? So motivational interviewing, Po and I have talked about this on the show. It's come out of this world actually originally from substance abuse counseling, but it turns out it's highly applicable, relevant, and effective for all types of behavior change and, eliciting, having the individual elicit their underlying motivation for wanting to make change, and then really like crafting the conversation. It's I heard this recently, Darrell. I don't know if this resonates with you, but people don't make change because we tell them to do something. They make change because of conversations.
They do, and it's based on helping them reach their aspirations. I love Dr. Eby's example of him working with an Alaskan Native grandpa who's getting pre-diabetes, and it's like, I don't talk about white coat stuff like A1Cs and glucose. He says, I talk about his aspirations, which is to teach his grandchildren how to hunt and fish, and how the tips of his fingers are incredibly important as they pick berries. And in order to keep the feeling at the end of his tips, his fingertips, this is what he can do. Well, now he knows how to apply these white coat procedures into his own aspirations. That's the goal. You don't change behavior because you tell someone to change. People change behavior because you help them see how they can reach their aspirations by making those changes. And aspirations are in all areas of life: financial, environmental, intellectual, social, relationship, physical, nutritional. Aspirations come in all forms. And when the healthcare system is built around helping you reach your aspirations, it's a very different looking healthcare system.
It is. Totally.
Healthcare won't be transformed by healthcare.
No.
It will be these outside organizations who completely transform healthcare because of their purchasing power, and because they're seeing that it can be completely disrupted.
Right. So anyways, I feel like this is something, I appreciate you. I'm so glad I was able to talk to you about this, because now I'm starting to, kind of connect this. And I love the fact that the whole relationship based healthcare is what it sounds like to me. Yep. It's relationship based. It's not based on, you have experts, but then it starts at meeting every client at where they're at. And like you said, what do they aspire to do? How long do they want to live? Right? Why don't we talk about how long I want to live first? And then you can kind of get an idea of where my plan should be versus, okay, well, you got this going on. But yeah, this is, this is great information. Like I totally, now I feel like, man, I want to talk to everybody about this. My wife gets home today. I'm like, guess what I learned today?
Well, that's what I'm trying to do. Is I would love for more and more citizens of America to go, boy, I could have $6,000 in my pocket every year. If we could just wake up business leaders to this huge blind spot, I'll go wake up my CEO. Right. I'll go tell him about this.
Yeah.
It's like, why in the world? And truly, I think this is our country's biggest financial fumble and problem. Because if you look at all the industries in America, which is the largest? Healthcare.
Healthcare, yeah.
And of all the money we spend in healthcare, half of it, $2 trillion, 10% of our entire gross domestic product is going in to pay the profits of hungry people that are just stealing money out of our pockets.
Yeah. Po, how much do you think goes to prevention of that percentage-wise of that $4 trillion?
Hardly none of it. When if you were to apply the Nuka model, you would be saying 2-3%. That's where we're going to spend our money.
Yeah, it's 2% of our money. And that includes like vaccination efforts. So it's not even it's very little that is doing the things that Darrell, you're doing with Orriant or that you're advocating for.
I like to think about a cliff. So right now I started up 3 brand new hospitals. I built them at the bottom of the cliff, hoping that people would fall off. Well,
Yeah.
when you build a fence at the top of the cliff, it's like making sure everybody gets their annual visit to the doctor and their immunization.
Mm,
Well, an even better aspirational model is you're actually journeying with people on their path of life through relationships, helping them reach their aspirations, reaching their goals, reaching their destination.
Right.
yeah.
That's healthcare.
That's beautiful. That is just a virtuous society, and a more evolved healthcare system. It's wonderful. I also just want to thank you, Darrell. This was an incredible conversation. I feel like you have so much like energy and passion for this. It's not just what do for your job. Like this is your reason for being. You've heard of Ikigai?
Uh-huh.
That's a Japanese concept. It's like what the world needs, what you're good at, what someone will pay you to do, and what sparks you, what you enjoy. And I see that spark and that enjoyment from the very beginning of this conversation. Like this just excites you.
It's a worthy cause to pursue.
Hmm.
Yeah.
Awesome. So if people want to learn more, go ahead, Po.
No, I was just going to ask, where can people find you?
Yeah.
So aspirationalhealthcare.com is probably the best place to start because like Dr. Rex said, there's just lots of good information. Orriant is a coaching company that is one element of an aspirational model. I also have a website called darrellmoon.com, which if you want to use me as a speaker or you want to engage me in a consulting role, you can go there and watch lots of videos as well. So there's content on all of those, but the one that probably has the most content relative to our discussion today is aspirationalhealthcare.com.
And Darrell, you've put all the conference sessions from the last 2 years up there for free, completely free.
Yeah. Anybody can go watch them.
Yeah, it's pretty incredible. And Darrell, we'll put all those links for our listeners. We'll put all those links in our show notes. And and I want to thank everyone for listening to this conversation. Yeah, Darrell,
appreciate it.
It was a privilege and an honor to have you on our show. And I think
keep
your
the good work you're doing.
It epitomizes why we call this show the Health Feast. That health is something that allows us to live a life that we want to live, that's super fulfilling and almost feels like a feast.
Yep.
So, and before we go, this is one thing that I always ask our guests. It's just, if we're having a health feast, right? And we're having a feast, what would you be bringing? It doesn't have to be food, or it could be food, I guess, but we like to, what ideas are you bringing? Last notes or something that people will know you off, or what do you want to be known for, or what do you, and that connects to what are you bringing to the health feast?
It's what Dr. Rex said. It's relationships.
Yeah.
Bottom line, relationship-based healthcare.
Awesome.
All right. Well, thank you very much for being here with us.
Thank you. Good to visit with both of you.
All right. We'll see you all back here next time. You can visit us at thehealthfeast.com or follow us on Instagram or YouTube at The Health Feast. And we'll take care. Bye, Darrell. Bye, Po.